Hi, Miss Debate.
Hi there.
I'm Shelly. I'll be your nurse for today.
Hi, Shelly. It's good to meet you.
Nice to meet you. So tell me what brings you into the women's clinic today.
Okay. Well, I'm 36 weeks pregnant with my very first child. It's exciting, but definitely a little bit nervous as well. And I'm just foreseeing to the very near future of having to go through labor. And obviously heard it's a very painful experience. But I've also heard that a lot of pain medications can cause like my baby's heart rate to go down or just other bad effects. And I was wondering if there are some pain control methods I could use that don't involve medications.
Okay, well, pain during childbirth is a very common concern for you to have. You're correct, some medications can pass through your placenta to your baby, especially the ones we give during labor. But each medication has different benefits and risks that we'll have to weigh once you're in labor. There's many different methods we can use to help decrease your pain level that don't require medications at all, or we can use them in conjunction with medications. So let's discuss a few of these techniques.
Okay.
So sometimes changing positions can help alleviate some of the pain and discomforts that someone may have during pregnancy. One of the things we want to do is kind of raise your head up a little bit, and also if we can get you to move to the left side and lay on your left, that could also help with one of the big things that women complain about during pregnancy is back pain, and so that'll help out with that. Okay? So I'm going to raise your head. Just let me know if it gets too uncomfortable with the change. Okay? How's that?
That's fine.
Okay. And then what we're going to do is see if I can get you to grab this rail over here with your right. I'm going to help you kind of lean over. Okay. And I'm going to put these pillows in behind you. Kind of keep you propped up. And then put this one in between your knees. Okay. All right.
Hydrotherapy is the use of water to promote relaxation. It helps soothe your muscles, and just the sound and the movement of the water can help you relax. Some people use whirlpool baths for this. We don't have a whirlpool bath here, but we do have showers. Would you like to go to the shower?
Yeah, that'd be great.
Okay, here, let's go ahead and get you up. I've got towels all ready for you here.
Okay, Mrs. Debate, I see that you're progressing well through labor. One of the other things that we want to talk about today that will help you out and kind of relieve some of the stress and pain that you're having is practicing breathing. So there's two different methods we're going to go over. And one is just taking a nice deep breath in and out. Okay, so let's practice that together. Just and out. Good, and this can be either through the nose or the mouth, whatever's most comfortable for you. The important thing is getting the deep breath in and the deep breath out, okay? And then the other method we're going to practice today is actually doing a type of panting where we go, okay? And that's another way to help relax yourself as you go through labor, okay? So if you want to practice that with me real quick, we can do the method as well. Okay, so here we go. Okay, good. Just like that.
Now, Mrs. Debate, this is what we call a birthing ball. It's basically just an exercise ball. A lot of women find it comfortable to sit on before, during, and even after labor. It will provide support for you and some counter pressure to help relieve the pain. So when you sit on it, your bottom's going to be here, and then your legs are going to go out at an angle to create a triangle, okay? So if you want to go ahead and sit on the ball, I'll hold the ball still for you. Okay, you can take a seat. And during labor, if you sway in a circular motion, yeah, just like that, it can help progress your labor. So in addition to helping with your pain, it can shorten your labor by about an hour or so. Does that sound good?
That would be great. Yeah.
One of the other things we want to talk about is music, okay? That's another great way to help kind of relax you and ease the stress of labor. So is there a favorite band or a favorite song that you like to listen to at home to kind of help raise your spirits and keep you relaxed?
Yeah.
Yeah?
Actually, if you'll hand me my phone, I can pull it up.
Okay.
Play it.
Here you
Thank
go.
you. Okay, here it is. Helps me relax.
Yeah?
Mrs. Debate, another thing that we can do to help with your pain is warm or cold therapy. So we can place ice packs either on your abdomen, your lower back, or your groin. And later, if you want to, we can try a warm blanket as well. Where would you like your ice pack?
I think my abdomen.
Your abdomen. Okay, let's go ahead and place that right there. And you can kind of hold that in place.
Okay, yeah. Thanks.
So, Mrs. Debate, another thing we're going to talk about is guided imagery to help you out with relaxing, okay? So, with guided imagery, it can actually help you lower your pulse, it can lower your blood pressure, and also help alleviate some of the pain.
Good.
Okay? So what I want you to do is just go ahead and relax, close your eyes, and think of a happy memory. Think of some time when you were extremely happy and life was just great. Could be some vacation you were on, could be spending time with your loved ones. And I want you to just picture that and remember the deep breaths we talked about earlier. Just put yourself in that place. Put yourself in that mindset. Okay.
Mrs. Debate, do you usually pray?
Oh yes, all the time.
Okay, that can also be a source of strength and comfort for a lot of people during labor, and even people that usually pray. Just the pain and the intensity of labor sometimes makes them not think of that during labor, and so we like to mention that beforehand to kind of prepare you for that time, because that can definitely be a source of strength for you. And if at any time during your labor you want the chaplain, just let me know and I can get him for you, okay?
Catherine, honey.
Hey.
Hello. Oh, I just got in from the Outback. How are you doing?
I'm good. Coming along.
Oh, he looks great. Oh, he's kicking. Hi, I'm Jim.
Hi,
I'm
nice
the
to
husband.
meet you.
Good to meet you.
My name is Hope.
Hi, Hope. All right, how's she doing?
Mrs. Debate here's been doing great.
Okay.
We've been practicing some techniques to help her with her pain.
Right.
And now that you're here, there's some things that you can do to help out. So the first thing is slow dancing. So Catherine, if you want to
Okay.
Come on, honey.
Okay. And you can just, if you want to place your hands at her hips, then
Yep.
she'll place
Yep.
her hands on
Yep.
your shoulders. And you can just sway back and forth. And
Let's go.
this will help loosen up the hips and just help her
Okay.
relax, okay?
Okay. You doing all right?
It's good. And I can do that for as long as you want. Another technique that I wanted to teach y'all is called partner squatting.
Okay.
And so for this, what you're going to do is you're going to stand across from each other and grab each other's wrists.
Okay. All right.
Okay. And then this is kind of a trust exercise too. You're going to you're going to take each other's weight and you're going to go down all the way into a squat, okay?
Okay. All right. Nice and
And this will
easy.
help open up her pelvis.
There you go.
Okay, and then when y'all are both ready, at the same time, you'll come back up.
Okay, you ready?
Yeah.
All right.
Great.
All
I
right.
feel really good.
Yeah?
So, Jim, Catherine has been sitting on what we call a birthing ball.
Okay.
And it just provides some support for her, some counter pressure. And she's been doing some swaying that helps move her labor along. And there are also some things that you can do for Mrs. Debate while she's on the birthing ball.
Okay.
The first thing is called the hip squeeze. So you're going to want to take your hand and find the flat part of her spine here called the sacrum.
All right.
And once you find that, you're going to go to either side and you're going to put pressure inward and up.
Okay.
So your hand should be angled like this, and then you'll put pressure inward and up. So if you want to
Okay.
practice that.
All right. So right here.
Perfect.
Inwards and up.
Inward and up. Yes.
How's that feel, sweetie?
That really helps. Thank
Good.
you.
Okay. And then another thing that you can do is put counter pressure on her hips.
Okay.
So what you're going to do for that is you're going to find her hip with this hand, kind of cupping motion like this, and then you're going to go from her spine. If you're on this side, you're going to go to the left, and you're going to push inward and up again. And so the pressure from one hand should be going towards the other hand. And this just helps to alleviate some of the pain by producing a counter pressure.
Right. Easy enough. Okay. So right in here. Is that okay?
Great.
All right, and then push inwards and up. Okay.
How does that feel, Mrs.
So I really
Bay?
like this again.
Okay. And then the other side too.
Mm-hmm.
Okay. All right.
Great. Okay, so walking can help increase the blood flow to your uterus, which will cause the baby to descend further and help move your labor along. So let's go ahead and start walking.
Okay.
And Jim here will be right next to you if you need someone to lean on during your contractions. So we'll see if we can do an entire lap around, okay?
Okay.
So just remember, no one technique works for every woman, and some methods may work for part of your labor, but not for the others. So you want to be able to experiment before you go into labor, as well as during labor, to see what helps you with the pain management the most, okay?
Okay. The techniques I learned really helped calm me and reduce my pain during the birth of our beautiful baby boy, Jimmy.
Thanks, nursing staff.